Welcome back, everybody. So we've got more to talk about now, kind of getting into more of the serious stuff here. And we're going to start up with a story out of Portage Park.
Yeah, so this is kind of a big headline, I guess, for folks if they're looking online, coming across this article. We're talking to Block Club Chicago because a hospital in Portage Park has some referring to it as a death hospital.
Yeah, really hard to hear that term, and a lot of hospitals that start to go through some issues can certainly go through that phase. Let's go ahead and bring in our friend Manny Ramos. Good morning. Thank you so much for being here.
Good morning. Thank you for having me on. Appreciate the time.
So a lot of times when a hospital does get this kind of unofficial designation here, it is because, like I was saying, that they are going through maybe some financial difficulties or some things that cause the community to say this place needs better care for the people that they're caring for. So give us an explanation of where they are with things and what we're seeing on this screen.
Yeah, so what we're seeing on the screen at the moment are some photos that have been shared with me from staff, from patients, and all around, essentially outlining some of the issues. So you're seeing water, falling from the ceiling. You're seeing bodily fluid out in the open, as well as patient food trays sitting on biohazard waste bins. And those last two things sort of present an issue for patients in terms of cross-contamination, the spread of infectious diseases. And what we've been reporting on in this story is sort of this hospital on the northwest side that is a for-profit safety net hospital that serves primarily low-income patients who rely on government-sponsored insurance, such as Medicare and Medicaid, and the issues that they're facing and the fear that they have for going to this hospital. As you mentioned, in terms of financial issues that the hospital has faced, that is well documented, and we sort of examined those financial records through their Medicare cost report filings.
What has the hospital's response been?
The hospital essentially said, they need more financial help. They claim Medicare Advantage reimbursements have been extremely slow or non-existent, which causes the further decline in their revenue shares. And as well as they just can't really talk about the individual cases or anecdotes that have been shared with me, so they wouldn't comment necessarily on some of those more concerning issues that the patients have shared.
So let me ask you this. Obviously, when you get a term like death hospital, that means these issues aren't anything new. So what would be new is the big beautiful bill, as it's being called. How does that factor into concerns moving forward?
Yeah, so the big beautiful bill essentially, it could possibly, well, more than likely will, affect large shares of Medicare and Medicaid patients who rely on safety net hospitals such as this. And this hospital, again, which, most of its funding is through government-sponsored insurances. So with less and less patients having insurances from Medicare and Medicaid, this puts them uniquely at a disadvantage that could continue to sort of continue what experts have said is a financial death spiral, and lead to either more safety concerns, more problems within the hospital, and ultimately closure.
We look at some of these pictures that are from the hospital, and you have to think, how did they get away with this for so long? Because I know in your article you mentioned an incident that happened back in 2022, was it?
Yeah, so the story opens up with a 27-year-old woman who fainted at home and was sick for about several days. She was diagnosed with the flu at the hospital days earlier. But when she fainted and she was experiencing shortness of breath and she was struggling to breathe, her family called an ambulance to sort of help, and they ended up taking her to Community First Medical Center. While she was there, her conditions was never medically assessed. She was never triaged properly, but she was given an ID badge on her wrist. She ended up sitting in that waiting area for about 40 minutes, falling in and out of consciousness as her family tried to console her. Her family members went to the triage center where the nurses are usually stationed, seemingly asking for help. And then finally, when a nurse arrived, again, 40 minutes later, it was ultimately too late. She ended up passing away in the waiting area, and within about an hour and a half of first entering the hospital.
I think that's a worst case scenario type of situation. Obviously, you don't want to hear about that happening anywhere. I understand they've also had a lot of facility shortages and you know, elevators that were out and things of that nature as well. If their funding is such a big issue here, what changes could be made and how could that happen? I mean, how do they get to turning things around? Because obviously there's concern if it shuts down, even for the community, if they lose that facility.
Yeah, I mean, this is a safety net hospital. It's crucial for the community, and whether or not how this hospital can stay open, I'm not a politician. This is obviously something that this funding needs to come from the federal and state level. That really needs to address that, and so I can't really provide any kind of conclusions on what can help. But with that being said, a hospital that is serving low-income patients shouldn't provide this kind of service regardless. Low-income folks shouldn't be subjected to this kind of care,
right.
And it's something that the state should, think critically on examining further.
Well, do you think that since you're shining a light on this, that more attention and more resources will be put towards a hospital, or do you see things declining even more and maybe closing? I don't know.
Yeah, I can't say to that either. What I can say is, speaking with dozens of patients as well as staff who work there, they're extremely concerned about how this hospital is being managed at this particular moment. Some stress that they actually want this hospital closed. Others, want the hospital to be serving the community as it was promised when the owners took over.
Yeah, Manny Ramos of Block Club Chicago. We always appreciate this partnership that we have with Block Club Chicago because of the reporting that you all are able to do. Thank you for sharing what you've learned with us, and please continue to keep us updated. We appreciate it.
Thank you again for having me on.
Absolutely.